Good morning, Chairman Dutton, members of the committee. My name is Lori Kirkendall. I'm here to testify to you. Thank you for the opportunity in full support of Senate Bill 347. I serve as President and CEO of Medical Institute for Sexual Health. We are a national science-based public health research and education organization founded here in Austin in 1992. I previously served as executive director of Aim for Success, which is the largest provider of live sex education programs in Texas. Over the last 25 years, I have worked with at least 50 different school health advisory councils. And as I've stated, I am in full support of this important bill. This bill requires all SHACs to be operated as open governmental bodies like the school boards they support. It will help clarify the role of and strengthen the effectiveness of SHACs and assure that they are compliant with their original intent set forth in Texas Education Code 28-004, which I've provided in its entirety for you this morning. You may be aware that the State Board of Education adopted new health education TEKS in November for the first time in 20 years. I served on several work groups and provided invited testimony to the SBOE, specifically addressing content on reproductive and sexual health. Given the extended content in the new revised TEKS, SHACs are needed now more than ever to make curriculum recommendations that comply with the Education Code, fulfill the TEKS, and most importantly, as we've heard, reflect the values of the local community of all 1,029 Texas school districts. The SHACs I've worked with are all over the map on membership, policies, and procedures. Many have conducted their work with limited accessibility and transparency for the local community. The original intent of SHACs is clear to reflect the values of the community in selecting health curriculum, including human sexuality curriculum. To do so, its members and activities need to be open and accountable to the parents and families they serve. I'm hopeful this bill will allow SHACs to better serve their communities and promote the optimal health of all their students, and will provide a means of ensuring compliance in all districts. Thank you.
Any questions of this witness, ma'am? Members? Not hearing any. Thank you for your testimony, Ms. Kirkendall.